We will talk about strategies to overcome ethical issues and moral distress.
First, nurses must be familiar with the Nursing Code of Ethics as it implicit standards and values for the profession. This Nursing Code of Ethics serves as ethical guidelines for nurses to provide a sign of the profession's commitment to the public it serves, helps to outline the major ethical considerations such as informed consent, and do not harm and confidential. It also becomes the guidelines for professional behavior such as safety, communication, and accountability. Act a framework for decision-making to solve ethical dilemmas. The purpose of Ethics Code is to protect patients' rights, get informed consent for treatment, staffing patterns in team, advanced care planning, and surrogate decision-making. The second strategy is to seek ethical education in nursing. Ethical education involves exploring different worldviews and beliefs, considering ethical dilemmas, and the process of ethical decision-making. It is important for nurses as it will increase ethical awareness and understanding or greater motivation to act ethically in daily practice. For example, nurses can seek and speak to mentors, supervisors, or even nursing educators to gain perspective about nursing ethics. Besides, ethics education will influence both confidences in one's ability to make ethical decisions and also moral actions. This is because ethics education can help nurses develop confidence in their decisions and have to know how to take appropriate action when they encounter moral dilemmas in clinical practice. New employee orientation and educational programs should include ethics content, with specific examples of how to apply theoretical principles to concrete issues. Third strategy is to create an environment where nurses can speak. It can be done by providing an ethics expert to act as a clinical consultant where the clinicians can confidentially talk with are valuable in helping people to look at the situation from other perspectives. Having a practical environment will support nurses to raise the ethical questions, and empowering them to address those concerns is vital. This is because ethical issues are complicated and everyone has their own experiences and values to the situation. So, they are encouraged to ask questions with each other and understand the choices they have made. Hold a family conference is also the strategies to overcome ethical and moral issues. Family conference is the process in which group discussion is made by using problem-solving techniques to determine the ways of providing care for the patient. Patient, family members, nurses, healthcare team providers, and doctors are involved in the family conference. Meetings should take place in a dedicated room in order to preserve confidentiality as the information about the patient's condition is provided to the family members. This is because family members often perturb the nurses and caregiving team asking about the patient's status, and this may cause conflict between family members and the healthcare providers. It is the approach to involve patient, family members, and caregivers in charge of the patient in the decision-making process, especially as regards decisions to limit or withdraw life-sustaining therapies. This decision capacity should be considered to cover the ability to receive and understand information. Appreciate one's own situation and potential outcome, make a conscious decision, and then make that decision known by communicating one's wishes to the entourage. So, the involvement of the family in end-of-life decision-making should be organized properly to prevent ethical issues to occur. Anticipating the family's wishes is a simple measure that should put in practice. It can be done by facilitating the presence of the family at their loved one's side at all times, by involving the family, where possible, in the caregiving process, and in decisions concerning treatment, particularly end-of-life decisions. It also can invite the family to participate in the care procedures, with the help of a healthcare professional, and families should be allowed to stay overnight at their loved one's side, especially in end-of-life situations. So, the involvement of families with a view to reducing the potential for conflict and improving family satisfaction. Offer nurses the counseling service is another strategy to overcome the issues. Nurses will have an individual session with a counselor to share their experience about the ethical issue which is related to something that is happening in their personal lives or how the current situation rekindles past events. It will prevent the nurses to have mental distress symptoms. So, this counseling service will make nurses feel better and easier for them to voice out the worries in their minds. As nurses knew that the conversation between nurse and counselor is confidential. In conclusion, ethically challenging situations will never be eradicated from nursing. In fact, advances in care, new technology, and growing knowledge will increase dilemmas. Nurses also have to confront difficult situations by respecting patients, family, and other providers without undermining their moral integrity.